I'm Dr. Rohini Paul from Aster Hospital. It's part of the nursing skill tips. Today I want to talk to you about the pressure ulcer stages. As nurses, we always have difficulty to remember this one aspect. So as we all know, there are 4 stages of pressure ulcer. That is our nursing assessment. First, you should remember there are 4 stages. So how to go about remembering this 4 stage? That is what I'm going to talk to you now. The first stage, you connect it with something so that we can remember. So always the first stage, you connect it with your first layer of your skin. The second stage, you connect with the second layer of skin. The third layer, you connect it with the third layer. The fourth, you connect with the fourth layer. This is what you should remember as the first level. So what is the first layer? The first layer of skin, it is epidermis. The second layer is dermis, and the third layer is subcutaneous, and the fourth layer is muscle and bones. So again, the first stage you connect it, the first stage of pressure ulcer, it is on the epidermis. The second stage of pressure ulcer is on the dermis. The third layer is on the subcutaneous layer, the fatty layer, and the fourth stage is affecting the muscle and bone. Now again, as nurses, we have one problem of remembering. Is the epidermis on top or the dermis on top? So for you to make it a small tip, always remember epi is on top, sub is on down, and dermis come in the middle. So now I am sure you can remember epidermis is the first layer, dermis is the second layer, subcutaneous is the third layer, fourth is muscle and bone. This includes 4 stages, and this is what you will be able to assess. One more thing to continue, I want to tell you, what is that first? When you as a nurse to assess the pressure ulcer, when do you say it's a first stage of pressure ulcer? It is on the epidermis, on your superficial skin. When there is a color changes, if the skin color is fair skin, you might find the redness of skin. So this redness, even if we sleep 8 hours together, there is a pressure. After some time, the redness goes off. But here when you are going to define is a first stage of pressure ulcer, after pressing it for 10 seconds, the redness does not go away. So you come to the conclusion, the epidermis is affected, that you conclude first stage of pressure ulcer has taken place. When you call it as a second stage, the epidermis and the dermis is affected, the first layer, the epidermis skin peels off. There you find a lot of serous fluid, so you are at danger. So this is what we call it as a second stage. The third stage, when the pressure ulcer has extended up to the subcutaneous fatty layer, very dangerous, because there the organism can erode lot of tissue and you are in very difficult situation. So that is what the third stage of pressure ulcer. The fourth stage, of course, it is involving the muscle and the bones. So that is called the fourth. So I am sure this is the way. How do you connect 4 layers? How do you make it into 4 stages? When you will call it first, second, third, and fourth. I am sure you understood this, and I want you to store this in your brain, not in your paper. Thank you very much.